Hello, my name is Lee Harrington of PassionandSoul.com and TraversingGender.com. I'm honored to be on here today to talk about transgender issues because it's an incredibly wide array of topics and concepts. Now, I myself am a transgender man, and what that means is that I was assigned female at birth and that I now live my life full-time as a man. Now, that's a complex issue in and of itself, so I want to break it down. Assigned gender is what, when the doctor or your midwife picked you up, that's what they said you were, and that's what they put on your birth certificate. That is very different sometimes than how you were raised, because two different people who were assigned female at birth will be raised in very different ways, even within the same culture. It's interesting, though, that how a lot of people were assigned at birth determines how they were raised and how they even have their life determined for them, consciously and unconsciously. People who were assigned female at birth often get told, "You're a pretty girl and aren't you sweet?" While people who were assigned male at birth end up being told, "Aren't you a smart boy, or a clever boy, or a strong boy?" For myself, it wasn't necessarily about any of those things of how I was raised in culture. It was about who I was as an individual. That is about gender identity. Identity is who we are as people. Now, this can sometimes be the same or different than how we dress, our gender expression, which can be the same or different than what our legal gender is, which is what it says on our school ID or our state and national identity on our passports. This is also similar, the same, or very different for some people than what their social gender is or their gender expression around the people in their world. This is how they operate in their day-to-day life. Not just how they dress, but the pronouns that they use. He, she, they, or something else entirely. And someone's medical gender or medical transition is about what their medical journey has been about, which is everything from somebody who was assigned female at birth, choosing to bind their chest, or someone choosing to or pursuing the path of taking hormones or having different medical procedures. For folks with whom all of those or the bulk of those line up, one of the words that gets used is cisgender. This is a different one than, of course, what you hear oftentimes in the conversation of transgender. Both cis and trans are adjectives, not nouns. Adjectives. It's like saying blonde. This is really important, or perhaps tall. It's really important, though, to keep this in mind, because when people sometimes say the transgenders, it can be seen as really offensive. Now, that's not a universal statement, but for a lot of people I run into, sometimes even saying the transgenders can be as offensive as saying the blacks, or anything else in that spectrum that's considered kind of bigoted, kind of offensive, or incredibly offensive. There are subpopulations who use the words of such things like "I am a transgender," but that is for someone to state themselves rather than for somebody who's a professional starting the conversation with. If somebody uses that term for themselves, or any term for themselves, that is a term that they have the right to use, and not necessarily appropriate for a professional to use, unless that is something they have asked you as a professional to use. Now, one of the things that I like asking folks when I have people come into a discussion with myself, and I have a lot of people that I know who are professionals, is to break down, even sometimes on your intake forms, what is somebody's assigned gender or assigned sex, what is someone's gender and what is someone's pronoun. Because that way you know, oh, what is her preferred term? Or she prefers that sort of thing, as compared to saying he is that sort of person. They like those sorts of things. For myself, I find that incredibly useful, and if you find yourself slipping up, it's okay. Because what is easier to do is say, oh, I'm sorry, and move forward with the conversation rather than sticking on that issue. Because if we say sorry, sorry, sorry over again, it makes it about us rather than their journey. This is very different than saying, oh, you look like a girl. I'm sorry, I'll keep messing up. That can feel really invalidating for a lot of transgender individuals. So I myself identify as a trans man, transgender being the adjective, man being the noun, who I am. I meet a lot of people who being a transgender man is about their medical history, and they identify as men. End of sentence. And the fact that they're transgender happens to be for you as the practitioner to know, not necessarily for anyone else. And to share that information is called outing. It's to out their history and their story, and sharing that somebody is transgender isn't anyone else's to know. If you're talking to another peer who needs to know that information, make sure that they understand that this is not for common consumption. Pointing that information out around a group of people can be really invalidating and sometimes dangerous. Every single year in the United States, large numbers of people who are transgender are killed. In 2016, it was 17 people. How heartbreaking is that? With an overwhelming number of them being trans women of color, people who were assigned male at birth who were women of color. It's heartbreaking, and these are intersectional issues that need to be kept in mind. And as I said, they're not universal terms. For people who are Spanish-speaking, there's a term that gets used of Latinx, Latinx, for example, because Latino and Latina are profoundly gendered terms. Also, for people who are working from various Native American or indigenous populations, there's other terms as well, such as Two-Spirit, or other ones that appear all over the world. This is not something that the United States made up. It has been happening as long as people have existed. Now, the reason I bring up the notion of sex being important to know and gender is that you'll often sometimes hear some confusion around how orientation plays into things. Sex is what a doctor thought I was by looking at my genitals. Gender is who I am and how I see myself to be. Orientation is who I'm into. It isn't about my gender at all, it's about who I'm into. And so there are people who are trans men, like myself, or trans women, who are interested in men, some who are interested in women, and some people who are interested in anyone as long as they're someone compatible with them, who loves them and cares about them. And so as professionals who are working with HIV populations, making an assumption about any of your practitioners around what their identity is or orientation also doesn't have to necessarily match up with what their sexual behaviors are. Because as a trans man, you don't know if or how many or what types of medical procedures I've had. And so you don't know whether I am someone who still happens to have a vagina or vulva, or whether I am someone who has chosen to pursue various forms of genital reassignment surgery and might have some sort of protophallus or full extended phallus. You don't know by looking at me or even by hearing that I am a transgender man. Or if you're working with a transgender woman, you don't know if they are someone pre-op, non-op, or post-op, with op being operational. Therefore, if somebody's coming to you, you don't actually know what their risk factors are for various sexual behaviors. You don't even know if somebody who is assigned male at birth, who has a phallus, who enjoys penetrative sex, you don't know if they're having sex with men, if that means that they're having oral sex, anal sex, whether they're having vaginal sex because they now have a vagina or one of their partners does, even though that person may or may not be identified as male. You don't know the behavior patterns at play, including if they're using condoms or not. If somebody has 30 partners that are all using condoms, it's a different risk factor than somebody who has one partner, but they don't know the status. Keep that in mind when you're working with transgender populations to find out what their behavioral patterns are, what their body realities are, and how that comes into play within your specific demographics. Also keep in mind that you're working within a female college. Now you might run into the issue of people who identify in a wide variety of genders beyond male or female, whether they're transgender or cisgender. There are people who might identify as gender queer or gender fluid. Somebody who's fluid moves back and forth. Somebody who is queer plays somewhere across the spectrum or finds their own personal identity within that experience. You might find people who are sapiosexual or attracted to intelligence, and you're going to run into tons of words beyond that. Don't just do your research, because that matters, right? Don't require them to teach you about everything. But find out for them when they say, I'm queer, what does that mean to you? Or what does that look like to you? Because if I say that I'm gay, does that mean that I am a top, somebody who gives sensation or penetration or activities, or am I a bottom, a receptive partner? Because if you hear that I'm gay, you don't know what my behavioral patterns are. You don't know what I'm into. Or if I happen to be choosing to be asexual, somebody who doesn't have a sexual identity or sexual interests necessarily. And you certainly don't know what my behavioral patterns are. So make sure to ask those things, and at a women's college also keep in mind that if somebody chooses to socially or medically transition, to find out what your college's policy are, or college's policy is, I should say, around such issues and topics, and talk to the person that you're with about how they're interacting with those issues and how they're dealing and doing as a population with those issues on this campus. That if you have trans women who happen to have transitioned in high school, for example, how are they feeling about being here at a women's college? How is the rest of the school treating them? And how is that coming into play with their sexual interactions? Because for some people who are transgender, they don't have an awareness or are really uncomfortable having the conversation around what barriers to use. If you're working with somebody who is a non-operative or pre-operational transgender woman, using words like put a condom on your penis can be really disenfranchising and really dissociating. But using a term like using an extended dental dam or condom on your extended clitoris can be something that can be empowering, even sexy. That there are ways to engage in the body that are beyond penetration, and so therefore trans women have those rights to do that, as do trans men. There are trans men who will use prosthetics of different sorts, sometimes referred to as strap-ons. Other people who use their fingers as part of how they receive a sensation as men. Find out what kind of barriers would serve them best. Would having perhaps some nitrile gloves serve them better than receiving a stack of condoms? Or finding out if they have any allergies applies just as much to various barriers they might use around dental dams as they might with receiving condoms. Make sure to tailor your message to the people that you're with, whether they're transgender, cisgender, or otherwise. I have lots of information on all of these details and others, and feel free to look at my information on my transgender awareness website, traversinggender.com, where you'll find a drop-down menu just for healthcare professionals. And I hope that you'll be able to find something for yourself there, or with my book, traversinggender.com. You can find more information also at my other website, passionandsoul.com, and I hope you have a fantastic day.